Good morning and welcome to the Department of Surgery Grand Rounds. It is indeed my pleasure to introduce our graduating PGY6 resident in plastic surgery, Dr. Luis Quiroga. Dr. Quiroga comes to us from Argentina. He has done extensive surgical training throughout the United States and has done a fellowship in burn surgery at the Johns Hopkins University School of Medicine and also completed his master's in public health. He's done extensive research, particularly in burn surgery and wound care and management. He brings a wealth of experience from his travels around the United States and general surgery programs. He is planning to continue in the West Virginia area, working down in the UHC hospital in plastic surgery and private practice. And so we are delighted today to welcome him to the Grand Rounds as our speaker. Thank you.
Thank you, Dr. Woodbury, for the introduction and very kind words. And thank you, everybody, for being here to the officially my last Grand Round as a resident. And I'm very excited. Thank you for being here. The topic of today is Argentinian pioneers in surgery, surgery and science. And it was a kind of interesting topic to me for two folds. One is some of these people has influenced my decision in my career, even though I never interact with them. But their stories, their accomplishment, and their life has been more than inspired, besides the touch of many patients and even the medical field. So I thought this opportunity to have this opportunity to talk about them, to tribute to them, and just get a little picture of them, which make the whole talk a little bit challenged because there is a lot to condense in maybe less than 1 hour. And at some point I feel that was not fair for them, but at least name them and highlight their accomplishment. So for disclosures, I have a couple. So this is an Argentinian view. So there is a perspective bias in here from my culture, and I put it like a comment of tango infused DNA. But there is a scientific integrity. So these accomplishments are truly based on science and recognized internationally. And I like to drink yerba mate, and it's something that kind of strange for some people here, but I think it's getting more popular in the U.S. It is caffeinated drink, and it comes from the natives from that region that we share in between Brazil, Paraguay, and Uruguay, but it still is a custom. So for about Argentina, most of you know is located in South America, is the second largest country in South America after Brazil. Brazil is a very large area, has about right now 46 million people there. The official language Spanish. Most of the immigrants came from Italy and Spain, and are all their influences kind of united with the indigenous population. So I would say about 80 to 90% of the Argentina has both Italian or Spanish root plus indigenous, which make an interesting mix in some ways. And then we have immigrants from other places more recently. The capital is Buenos Aires. The first time the Argentina name came into in the maps, it was probably in the 1500s from an Italian cartographer, and that was referring to the silver, and the Latin word argentum, and then it became a standard until today, Argentina. Here there is a little bit of the images from my hometown, and You can see kind of the downtown area. It is a mix of colonial and also more or more newer buildings. It was initially built as a university city, so it is the oldest city in that region, and it's the third oldest in Latin America, established in 1613 by the Jesuits. And then you can see a little more of the images of Buenos Aires and other areas that are famous for most people, Patagonia, which unfortunately I haven't been to those areas. And just kind of picture all the climate, weathers and type of scenery is kind of, you go from the tropical to the mountain to the cold. My particular area in Córdoba is kind of mild, and for the Spanish, it was very similar to their region, particularly Córdoba, the Andalusia, so they name it after that. There is a nickname for my city, which is called La Docta, referring to the amount of doctors and they have from that region. And here again, what make unique besides the landscapes from different areas, the tango is very rooted in our culture. Not only the dance, but the lyrics. People say that the older you get, the more you like tango. And actually, I found that to be true because most of those songs talk about all these experiences you have in life, and you have to go through those experiences to understand those songs. Soccer, in general, sport has been a big thing, but soccer, football, as we call it, has been almost religion to us, an obsession that is not much to any other country. And if you ever have the chance to see the last World Cup celebration with 7 million people and on the streets just on Buenos Aires was remarkable. Something that you won't see for other sport, mostly for religion, maybe in India. And then we are known for the natural wonders, the tango, the wineries. Music is too. The music is actually very eclectic. We have from the country folklore, which is a mixture of the Spanish with the indigenous, the tango dance and music, and then the most newest version of rock, and then the sport legends, the best well-known Messi and Maradona, but there have been many others, like Kempe from my hometown. He won the first World Cup for Argentina, and also all the ones that probably from my father's generation. Again, this is a picture of the cathedral, which is first established in the 1573, even before Buenos Aires was founded. And there's still maps of that time. It was very divided, very square, very easy to follow the structure of the Spanish, how they developed the architecture. And again, my university, National University of Córdoba, established in 1613. It is the third in Las Americas. Argentinians are kind of complex people in some ways. There are qualities that are very known. They are really passionate about things, very opinionated about everything from politics to soccer. And there is almost like a controlled chaos inside our culture. There is a recent posting in social media talking about you wouldn't understand Argentina, and even Argentinians don't understand it. And it is kind of funny. Like you will see Argentinians singing the anthem before a game on the street, almost dancing and jumping, which we don't see that in other places. Even here, when there was the Copa America, I have some videos of Argentinians in Times Square invading all like, and for an Argentina, that's normal. For other people, that might be scary and confusing. But that is part of our culture. So we are into passion debate, long conversation. Dinners go very long until late. So if you are an early morning person and you spend time in Argentina, you're gonna suffer because dinners are late after 9 p.m. And you don't stop there. You keep talking. And then yerba mate, which is an obsession, and also in Uruguay. It has caffeinated different than regular coffee in some ways because they give you some kind of flow. The mind is more peaceful. It's difficult to explain. It has some antioxidants, so apparently it has some benefit for aging, even though we haven't proved that. But it will be interesting to study those things. And then the chaos. And in the middle of all chaos, we have particularly gifted with some amazing scientists and innovators, which they had to fight through economies, constraints, and also political turmoil many times. They have been surprisingly successful in their field. And I'm not only just saying that because Argentina, I'm proud of them, because also they have a significant impact in the patients. So that characteristic of fighting against adversity to reach a dream, it is common. I wouldn't say everybody has that, but in the people you look that has succeeds on those fields, you still see the common pattern. And in some ways, the new ideas come from the necessity to develop something, and that the dreams can come true even though nobody else see it that way. For me, personal, René Favalora has been a hero. It's the first surgeon, actually doctor, I was exposed through the TV. I remember going to my grandfather's house and watching some cartoon, and after the cartoon, there was a show where he was doing a lot of prevention medicine, and my father tried to change the channel, but I just want to keep watching for some reason. And later on, when people ask me what I want to do, I pointed to one of the magazines where he was interviewed, and I said I want to be like him, even though I didn't quite understand the whole notion. I like what I saw with his explanation about health physiology to the common public. So he, again, is a renowned cardiosurgery, not only in Argentina, but here in the US. He came from kind of poor middle class carpenter family, and no doctors in that family. Graduated from the University of Buenos Aires, and then after that, he spent several years as a rural physician in Jacinto Arús, which probably no more than 1,000 inhabitants, and he established the blood bank. He was doing the common prevention medicine, also surgeries, general surgeries, and some of the cardiac surgery. One of his mentors had a connection here with Cleveland Clinic, and kind of motivate him to come here to expand his skills. And he did in the 1960s. He was doing those cardiac surgeries, and then after hours spending time in radiology watching the cardiac cath, and came with the idea to bring the saphenous vein and do the bypass more for a clinical treatment of the coronary disease. He did 100 cases, the first 100 cases series published in 1967, and it kind of shift to be an experimental treatment to become almost a standard care for coronary disease, severe coronary disease. He was offered to stay in Cleveland Clinic for a large amount of money, and he refused. He went back to Buenos Aires. He created a foundation, which served to everybody. He was very open about equality. And unfortunately, he was treating everybody without even insurance. He got into debt, probably in the 18 millions, and he was trying to ask for help from the government. And unfortunately, we have a failure as a society in general to recognize his needs, and he committed suicide in the 2000. Still has a global impact, helping many people with this technique, helping people in Argentina to be trained and also to expand the practice to other areas in Argentina. There was a memorial from Denton Cooley, a cardiosurgeon from the US, and it is a large note, and I was surprised to find and know that he said, although Dr. Favalora was always hesitant to carry the name of father of coronary bypass, he is the surgeon. We should credit the introduction of coronary bypass into the clinical area. Again, global impact, educational legacy. He was very humanitarian to the extreme, to would say, very idealistic about access to care independent of socioeconomic status. And yes, he, for me, was a hero and somebody who inspired me first to look for medicine, and then more in particular to get more in the training. Even though I was interested in cardiothoracic, never pursued that area. And my interest flipped to plastic surgery. And again, the main things about him, the legacy was equal access to care, ethical practice. He was very adamant about trying to be compassionate, but also respectful of every patient, independent of the educational background. And then he built bridges to continue education and training both in Argentina and the US. Another surgeon, no well recognized even in my country, is Enrique Finocchieto. He was an earlier surgeon. He and his brother were very talented surgeons. He spent some time in the First World War serving for free. He got a medal for that. But most important, he was a very creative mind. He developed probably about 100 instruments. Some of them we still use it today, like the retractor or the needle holder dissection, which is kind of cool. I have a picture of that. The table, the OR table we use now, it has the first model that he patented with motor. So until there, the OR tables were fixed. There were no way to change the height or kind of the shape of that bed. The headlights, he started using those based on the mining design. He changed it and also became like a very important thing that we still use it today. He was very rigorous medical documentation still. His way to teach and treat patients is present today in particular hospital Rawson in Buenos Aires. There are many operative techniques. There is one particular operative technique he described, which was muscle sphericthoracotomy in the 1935. I didn't have it here, but until then, most surgeons were just cutting through muscle without preservation of those. So he described that and kind of became a standard after. And again, innovation, teamwork, and then he was described almost as a Da Vinci surgeon. I was able to meet one of his latest students, and he was describing this surgeon died in the 40s, 1940. He was describing he was so precise and fast, efficient, not necessarily fast with the hand, but very efficient, no wasting movements. And he was able to do an open colic with local anesthesia in 45 minutes from skin to closure. And then he expanded his research in esophageal cancer, vascular technique, hernia repair, and then mostly thoracic innovation. These are some of the instruments that still you can find today, the Pinoquieto rib spreader, mostly used on sternotomies, and then this clamp, which allowed to do a ligature. Yeah, it is 90 angle degrees. And then maybe familiar to you, Pablo Mirici is a pioneer in biliary surgery. Is from my hometown. He was born in 1893. In the early 1900s, he developed, or he did the first intraoperative cholangiogram, or we used to call it miricigraphy. And then until today, when I was doing surgery there, you had to do it. It is not a question. You had to know how to do it for every case, even if it wasn't complicated. And then, of course, the Mirici syndrome that most of you are testing an abscess. He described that with the impacted gallstone and the 60 DAG, and also creating a more central obstruction. And yes, his work was also very prolific in publication, texting, and surgery. Until today, there is a school of Mirici. There are 3 surgical residences in Córdoba, and one is the Mirici school, and they follow kind of the same teaching. Another one, just a little jumping from one side to another, we have Domingo Liotta, which is a pioneer in heart surgery. This surgeon was trained in my hometown, but he came from another small town in Argentina, Entre Rios. He actually collaborated with Dr. Cooley and Becky to develop the first total heart, artificial heart, which was successfully implanted in 1969. And his engineer and design also kind of was the trigger to more advanced design about ventricular support and valves. So this was the actual first total heart, artificial total heart, which was transplanted in 1969 and allowed that patient to live 64 hours until the donor came available. The thing is that there was an issue with that. Particular, the heart was developed in Dr. DeBecky's lab, and he wasn't aware of that transplant, and there was a dispute, a legal dispute between Cooley and DeBecky. So, but besides that, all this innovation kind of increased the pathway to ventricular device assistant and modern artificial heart. He recently died in 2022 at the age of 97. It was an inspiration, very clear mind for his age. More recently, Julio Palmas, probably not a very well-known name, but his discovery or development of device with the balloon expandable stent has transformed medicine in general, in particular vascular surgery, cardiac, and now it's expanding to other areas like biliary. So transforming the need of surgery in those cases with a more non-invasive procedure. He actually is from Buenos Aires, La Plata, and came to the US and spent some time in California, but he developed this concept in his garage, UTC in Austin. He's, for that reason, in the Hall of Fame in the patent world. Estimated about 2 million procedures every year, mostly vascular, peripheral vascular, and about 6,000 for cardiac, only in the US. And then what you probably have seen, this stent with the balloon expanded, allowed to relieve obstructions on those areas. For more related to what we do in plastic surgery, in particular hand surgery, Eduardo Sancoli has been a hand surgeon, also recently passed away. He's well known for a particular procedure called Sancoli lasso, when the patient has intrinsic muscle paralysis in the hand to help with grip. He has been an educated, prominent in microsurgery, hand surgery, and also the biomechanic of the hand. He actually brought a lot of light how the hand worked, and that influence spread out outside Argentina. He trained many hand surgeons around the world. And this is kind of a picture of that procedure, bringing the FDS, flexor digitorum superficialis, as a loop around it. This is static, what they call static repair, to allow improvement of the claw deformity. And then we are fortunate to have few Nobel Prizes that had an impact, and not only in Argentina, in the world. Cesar Milstein, he was born in Bahia Blanca, Buenos Aires, in the 1927. He studied in Buenos Aires. He was a biochemist, and he obtained the Nobel Prize in Physiology in 1984, who he shared with the people at Cambridge. So he developed this idea of monoclonal antibody, going from the idea from the to get the multi-clonal to just one type of antibodies for diagnostic and treatment. So he has to be exiled from Argentina at that time because of the military dictatorship. So he went to Cambridge, where he did have some connections and continued his research there. What is impressive to me is that he never claimed any patent for the monoclonal antibody technology. He was trying to ensure a wider access and faster advancement, which fortunately today we have that possibility to treat different targets for cancer or even a diagnosis. So another kind of hero, and probably not many people know that, probably even from my country though. And then early on, we have a couple more Nobel Prize. Louis Leloir, he was more in the biochemical field. He won the Nobel Prize in the 70s just to understand galactosemia and how the metabolic of the galactose to glucose was interfered. And for that reason, he became award for that, or he was awarded the Nobel Prize. He was also a pioneer in regular metabolic glucose, like the glucose phosphatase, and explained why we can have a large quantity of glucose in the muscle without increasing osmolarity to the tissue, and kind of paved the way for scientific development. The other one is Bernardo Jose, which actually was his mentor, was early on, and also got a Nobel Prize for the pituitary gland and the metabolism and diabetes of related glucose. Besides that, besides to be an excellent physiology teacher and advancing the science in Argentina, establishing institutes and pathway to get grants and to get established as a scientist, he was a many time a political adversary from the current politics, Peron in particular. He opposed Juan Peron. He was very authoritarian, and for that reason, he has several problems to get a position in public universities. That compromised his scientific work, but not his integrity. He has to find ways to continue work in Argentina and still get this recognition of the Nobel Prize when he was politically persecuted at that time. So all these legends in some ways in science and surgery have told me the global impact is start locally, and whatever place you are, start always small, and you shouldn't undermine the idea of how much influence you have in other people. You can be an inspired person without knowing to not only your patient, but also your colleagues and medical students. Mentorship it has been a very important thing for science and medicine. And then the important to returning to serve other with less privilege that you have. So during that journey that I didn't want to spend a lot of time on that journey, I had the experience to have both worlds from my Quiroga, Argentina, which established the foundation of the clinical integrity and diagnosis, and then move it to the US, which actually was motivated from teachers I have at the university. And then these people that I talk about it, they also have a similar pathway to expand knowledge. The idea to be exposed to different perspectives for the same problem actually help us to advance. And I think we should continue to do that. We don't work in silos, we work as a team. And the American training for me has been wonderful, not only the advanced technique, but the kind of knowledge and pathology we were able to treat during this time. And then the human connection, networking with different people from different specialty has been enriching. So one of the characteristics of all those people it has been resilient in resources constraints. Sometimes you may not have all you need to, or what you think you need to start something, some dreams, some goals, some device, but these show you that it's possible if you still believe on those. And it might be that those constraints actually help you to be a little more creative in your designs and solutions. High tech, it is wonderful, I would say, and in some ways are saving time and maybe get us a little more precise in some of the diagnosis, but it's still the fundamentals of human interaction, communication doesn't change. And then again, the Argentinian approach, what I have learned is the value of personal connection, and it's still valid today. It is a basic thing, not only with my colleagues, it's also more important too with the patient. And then the America integration with the cutting-edge technology, new knowledge, and the possibility to measure outcomes in a more consistent way. I think for innovation, there are a few key things I noticed on these people is these people are unsatisfied with the answers. Usually the question assumption, the question what is being taught. I have heard that for a person to be more creative or find new ways, it's easier when they are less trained and less knowledgeable of the field, because when you get in that phase, almost like your mind narrow down to what it is possible. So I feel that these people are still even knowledgeable. They are able to keep that flexible mind to question their own assumptions and other assumptions, and to try to find other ways to do, or better ways to do or solve problems. And then I want to extend this short tribute to a long list of mentors. Many of them are not here, and actually, I wouldn't be here if I wasn't for their support. Particularly the more current attending faculty from WVU, the whole Department of Surgery has been very supported. They have teach me a lot. And then also the other heroes that we sometimes we forget, the scrap nurse and the techs, the supporting staff, the APPs, nurse practitioner, are the backbone of surgery excellence and the support of WVU. I want to extend this to my current inspired surgeons who have helped me to develop the skills and to reach the place I am today. Dr. Whitberry has been a particular leader, important leader and inspired person to overcome obstacles, to bring and build bridges between specialties and other surgeons from other areas. So I think has been a wonderful program director and model to follow. And in the same way to all of the attending, Dr. Uger, Dr. Maluf, and Dr. Brook, who have spent several hours to improve my techniques. And I don't want to forget about something very special to me. I had the chance to know and actually work with Dr. Fogarty. He has retired, but he has a long experience in plastic surgery. For a long time, he was the only plastic surgeon in the area, and he did more than 400 mission trips when he was working in the private practice and also covered the hospital. He has been an inspiration for the human part and also the technical part. But what I really like about him is he connected me again with the roots of Favaloro and his ethical and humanitarian concern about helping others with surgery. I have been very fortunate to be invited to his house multiple times. I feel part of his family, and he has supported me through hardships during this process. And I just want to give it a tribute, very short tribute. He deserves a pretty long one, and he's going to receive the Northern Humanitarian Award Plastic Surgery in the next meeting at ESPS. For all he has done, he has been chosen between 20 and the whole nation, and he's well deserved this. So thank you, Dr. Fogarty. And then again, the replay effect of mentorship. Don't forget about that. Don't underestimate that your action, your work can have an effect in the people around you. And you can instigate a pathway that you never expected. And that person can do something good for those patients. So even if it seems small, it can become a big thing. I think all these people never expect to have such a large impact,
they work only for the goal that they have, and fortunately, they also have the impact that push the boundaries of new knowledge and new people coming to the field with new ideas. So I carry forward those, or I try to carry forward those spirit, honoring tradition, practice, excellence, pursuing innovation, trying to keep those habits, and trying to keep an open mind to learn new things. And I just want to say thank you to all of you. Okay. And if you have any questions,
That was an excellent presentation. I'd like to thank you for what you brought from Argentina to West Virginia, here in Morgantown. I remember when you first came here, you were really excited about always coming up with innovative ideas. And you would walk around and say, oh, why don't we do this? Why don't we do that? So we appreciate even more now that you've told us about the rich history of innovation in Argentina, what you have brought to our message program. And we are looking forward to what you will continue to do. We also want to acknowledge that you will be in a community where you will be able to serve the people throughout the state of West Virginia. And we can see your compassion as you take care of patients. So your leadership, compassion, and all of those skills that you brought to us are evident in what you've experienced from your experience and perspective. We're looking forward to that level of pride.
oh, no, it's no problem. Thanks. All right. Well, thank you for being here, and it was kind of emotional to be in my last round as a resident, so that was good. But I'm happy to have a good audience, and I worked with many of you, and I love the time I spent together in the OR and SI. It was fun, and well, I hope our paths cross again, and maybe we can keep working together. All right.
That was beautiful. Oh my goodness. What a beautiful presentation.
I try to condense a little.
Coming about over the weekend, my face.